Standard and transmission-based precautions. Standard precautions. Set of rules that were developed by the CDC. Under these rules, every body fluid must be considered infectious. All patients should be considered as sources of infection. Blood, body fluids, mucous membranes, non-intact skin. Standard precautions must be used anywhere healthcare workers might come in contact with blood, body fluids, mucous membranes, non-intact skin. There are 9 steps to standard precautions. After gloves are removed between patients. Wash hands. After touching blood, any type of body fluid. After gloves are removed between patients. When touching body fluids, any contaminated items. Wear gloves. When touching body fluids, any contaminated items. Always change gloves between tasks and procedures. When in doubt, use gloves. Wear masks and eye protection. During procedures that are likely to generate sprays or splashes of body fluid, wear gowns. To protect the skin and clothing during processes that are likely to generate sprays or splashes of body fluid. Patient care equipment. Ensure that reusable equipment is cleaned appropriately before being used on another patient. Use one patient use items when available. Environmental control. Follow policies about cleaning and disinfection of beds, curtains, and other frequently touched surfaces. Linen. Handle, transport, and process linen soiled with blood or other body fluid in a way that prevents exposure and contamination of clothing, and avoids the transfer of pathogens to other patients and their environments. Occupational health and blood-borne pathogens. Never recap or bend needles. Always put needles and other sharp items into a red sharps box, which is a puncture-resistant container. Use private rooms for patients that may contaminate the environment. Patient placement. Use private rooms for patients that may contaminate the environment. Gowns, gloves, masks, protective eyewear, face shields, shoe covers, and surgical caps are all considered PPE, or personal protective equipment. Transmission-based precautions. For patients who may have highly infectious diseases, other precautions may be needed. These are called transmission-based precautions. There are 4. Airborne precautions, droplet precautions, contact precautions, reverse isolation precautions. Airborne precautions. Diseases such as tuberculosis, TB, can be spread by tiny airborne droplets. The droplets can stay suspended in the air for long periods of time because they are so small. In addition to standard precautions, the patient must also be in a special room with negative pressure. The door must always remain closed. Anyone entering the room must have on a high-efficiency particulate air (HEPA) filter or mask. Droplet precautions. Used for patients known or suspected to be infected with pathogens that are transmitted by large droplets, such as meningitis and pertussis, whooping cough, and other diseases that can be spread when a client coughs or sneezes. Masks must be worn when working within 3 feet of the patient. Contact precautions. Used for patients known or suspected to be infected with microbes that are spread easily by direct or indirect contact, such as MRSA, scabies, or pink eye. Gloves and gowns should be worn when entering the room or when having any contact with the patient or any surfaces or items in the room. Protective or reverse isolation. Used to protect certain patients from microbes in the environment. This is mainly for immunocompromised patients, burns, bone marrow transplants, and AIDS. The patient is placed in a room that has been disinfected and frequent disinfection occurs while the patient is in the room. Anyone who enters the room must wear gowns, gloves, and masks. OSHA stands for Occupational Safety and Health Administration. In 1991, OSHA established the blood-borne pathogen standards that must be followed by all healthcare facilities. The facilities face severe penalties if the rules are not implemented by employers or not followed by employees. These rules include: identify all employees who are exposed to blood or body fluids. Provide a hepatitis B shot free to all employees. Provide PPE in accessible locations. Provide adequate hand washing facilities. Ensure workplace is maintained in a clean and sanitary condition. Enforce rules of no eating, drinking, smoking or applying makeup in any area that could be contaminated with body fluids. Provide adequate containers for all sharps and other infectious wastes. Post signs at entrance to work areas where there is exposure risks. Provide a confidential exam and follow-up for any employee who has an exposure incident, needle stick or splash in the eyes or mouth. Provide yearly training about the regulations to all employees. Now study.